My name is Helena, and I work in the info and engagement team, and we've been asking you guys to send us some questions for things regarding COVID-19 and MS that you haven't been able to find an answer for. And thank you so much for that, all of the questions. We've compiled a few of them that we keep on seeing as a theme, and I'm going to put them to my colleague Claire, who's the information and engagement manager at the MS Trust, but she also works in the inquiry team answering all these questions. Hi, Claire.
Hi there, how are you?
I'm all right. We normally sit next to each other, don't we, in the office? But we're at different ends of the town at the moment. But yeah, so we're hoping that the quality of this film is okay. But yeah, people are getting used to all these video things now, aren't they?
Yeah.
Right. So the first question that we got. I've got MS and I take immune suppressing drugs, but I haven't had a letter from the NHS telling me to self-isolate. Why is that?
That's a tricky one, isn't it? We know that some people with MS will have got a letter from the NHS, and we think those are likely to be people who are on the particularly strong immune suppressing drugs, Lemtrada or alemtuzumab, and cladribine or Mavenclad, plus people that have recently had stem cell transplants. Now, that's not, but there are plenty of other drugs in MS which have an effect on the immune system. And because MS is an autoimmune disease, a lot of people are quite concerned that they are at risk. Now, the group of people that's been sent the letter by the NHS, that might be just a first batch. There might be more coming as nurses and GPs work through their caseloads and work out who specifically in their caseload they think is at risk. But I think it's fair to say that just because you haven't got a letter from the NHS doesn't mean that you're not vulnerable. So it's probably wise, if you are taking one of the other drugs, maybe Gilenya or Ocrevus, that does have an effect on the immune system, or even Tecfidera, where it's quite possible for some people to have their white blood cell count drop quite low some of the time, that they should be taking special care. Certainly following the social distancing, staying at home where possible, washing their hands frequently, the advice that's good for everybody. But yeah, like I said, just because you haven't had a letter doesn't mean that you're not vulnerable. So yeah, you use some caution.
And if people want to find out more information about which specific drugs, that's all up on our website, isn't it?
Yeah, our website's got, we keep it really up to date. So that's the A to Z page on coronavirus and COVID-19. We're keeping it up to date with all the advice from the NHS, from the government, and from the Association of British Neurologists, where they've made some specific recommendations about which drugs that they are most concerned about. And even for those drugs, if you've had them in, a year or 2 years ago, then that's much less of a concern than if you've had them in the last 6 months, because that would have depleted your white blood cells quite considerably, and that would put you at risk of getting that illness. Now, we have also heard from some nurses that they've been looking at people. It's not just immune suppressing drugs that might put you at risk, it's whether you might have respiratory problems, have trouble clearing your lungs, have other underlying conditions like heart or diabetes. And so some nurses are just putting a blanket, everybody over a certain EDSS, a certain disability level, they've been sending the letter out just because they've got a lot of people to sort through. If you have any concerns about whether you have or have not received a letter, then getting in touch with your own MS service or your own GP just to confirm whether that you haven't got one because they don't think it's a problem, or you haven't got a letter because they just haven't got round to getting it out yet.
Yeah, they're a bit busy at the moment, aren't they?
Everyone's a bit busy, and I think it's also reasonable to think that, even if you haven't got a letter, you should still be being really careful.
Yeah. It's better to err on the side of caution when it comes to this.
My mantra is always, what's the worst that can happen? And
here's another question. I'm self-isolating and I live alone. Well, what should I do about shopping?
So if you are self-isolating or shielding yourself or somebody else who's particularly vulnerable, somebody who the government has advised that you should stay at home and not see anybody for 12 weeks, then that can be a real problem if you've not got any way of communicating with the outside world. Now, you can sign up on the government website as somebody who is extremely vulnerable, and they will put you on a register and make sure local services get to you and get supplies to you. If you've got friends or family members that can shop for you or visit the pharmacy for you, then do that. They should be leaving your shopping on the front doorstep so you can get it. Having said that, there are also people who are very vulnerable who have carers coming in, and that's a concern for them as well. If you have carers coming in on a regular basis, you should make sure that the care provider is making sure that all their staff have got proper protective equipment and they know to wash their hands when they come in and be as careful as they can around you. It's all about minimising the risk. I don't think anyone can rule it out completely for everybody. And there are some cases where there's a balance. You absolutely have to have the care to get yourself up or get yourself a meal. But on the other hand, you don't need to do any more, doing any more than that would be, or not being careful would be a problem. So it's about balance, I think.
Yeah, and then we hear that supermarket chains, they are working harder to try and sort of make more available.
Yeah, that's right. There are a lot of problems with getting an online shopping slot in the first issue, but I think that's people are getting over that now. People are getting more likely to be able to get a slot, and also if you sign up with a local organisation, there's lots of local organisation community groups on Facebook or through your local council, or if nothing else, just call your GP maybe and say, who can help me? Is it something to do, some health or social care organised in your area that you need to be on that list if you don't have anybody else that can look out for you.
I think that sometimes there's better luck in trying the local kind of grocery and maybe the independent stuff, like, if there's a fruit and veg stall in your town or a local butchers and things like that, then they tend to, a lot of them do deliver and they might be easy to.
A lot of companies, particularly independent companies, are doing everything they can to look after their customers. And you're absolutely right. It's not just the supermarkets. There's a lot of independent shops who will be really very grateful for your support as well. And are going the extra mile to make sure that people can get supplies.
Yeah, absolutely. So here's another question about the letter. We do see a lot of questions about this letter.
About the letter, it did cause a lot of confusion, actually.
Yeah, it's not straightforward, is it? So in this case, the person is saying, I've got a letter from the NHS saying that I am extremely vulnerable because of my Lemtrada infusion. But my husband, he works in a hospital. So what do we do? He has to go to work.
Oh, it's so difficult, isn't it? And every family is facing issues like this. On the one hand, you've got somebody who's quite vulnerable if they were to become infected. And on the other hand, you've got a key worker who absolutely needs to be going in and out of the house to get to work. And that might be one particularly extreme position, but I think every family is facing that, who should be going out, who should not be, what happens in the house. So if you've got somebody who really should be shielding, they really should be shielding themselves from all outside contact, well, that kind of includes the husband. So taking it extremely, maybe they should be in separate rooms, separate beds, separate towels, eating from separate crockery, washing up straight away, all the rest of it. But on the other hand, if that's too much or too difficult, you don't have, not everyone has a separate spare bedroom that they can just go and sleep in. Then making sure that anyone that does leave the house is really, really careful about washing their hands, maybe changing clothes when they come back in, socially distancing within the house as far as they can. It's going to be so difficult, but I think every family is going to have to kind of find the balance for themselves. I know that in some hospitals they are providing overnight accommodation for key workers who do have somebody vulnerable at home, so it might be that the hospital can explore something like that, or that they can stay with somebody else. But there's going to be a lot of hardship and confusion and difficulty for people, and we can't underestimate that. But every family's got to work it out.
Yeah, and we see lots of people doing lots of different things here. I was on a video call with one of my friends when her partner came in, and she just turned around and shouted at him, going, "Up into the shower, close in the wash."
Yeah,
And I
yeah.
think that's, what a lot of people do.
It's made people really aware, hasn't it? And hyper aware. And, it's still worth saying COVID-19 for most people is mild to moderate. It's a small proportion of people that get very sick with it, and a proportion of that, again, who don't make it. For most people, it'll be a bad cold or flu-like illness. So although we're all really, really concerned and being really careful about those risks, keep it in balance.
Yeah. I think a lot of people get quite scared because, especially if you sit and listen to the news all the time. I mean, we've spoken about this in a few of the podcasts about how to actually limit your information a little bit, because it just gets overwhelming, and the
information is fine, but it's the endless speculation, isn't it?
Yeah.
And in order to maintain a 24-hour news cycle, news outlets are always searching for different angles and different problems that would never occur to you. So know what's relevant for you and your family, follow that advice, and then just let the rest go.
Yeah, definitely. And sort of always make sure that you get the information from a good source. If you're looking for MS information, come to the MS Trust. we are constantly updating everything, and we're working really, really hard to sort of stay on top of the current advice and what's going on.
Yeah, absolutely.
And you can always get in touch with us as well. I mean, we have had some changes to how we work.
So the inquiry service are working from home. So our phone number, you can still reach us on the phone number, but what will happen is it will go straight to voicemail, and we're checking that every half hour through the day. So leave a clear name and number, and we'll call you back as soon as we can. It's easier though if you can use our email address, and that's ask@mstrust.org.uk, and that will come straight to us, and we'll get back to you as quickly as we can. So we've got more people than ever answering the inquiries and making sure that we're keeping up, getting those responses out to people as quickly as we normally do. And we normally aim to get back to people inside the same day or the next day, if we possibly can. And if we don't know the answers, we'll say, we won't just give you, bad information for the sake of it. So if we don't know the answers to anything to do with MS or related conditions or COVID-19, then we will say, and we will point you towards somebody else that we think can answer your questions better. And we're not giving advice either. We're giving you the balanced, reliable information so that you can go ahead and make your choices. There's probably no right or wrong really in any of this. All we can do is give you what you need to make the choices for yourself.
Yeah, because I guess it's really important to know that even though this thing is happening at the moment, that doesn't stop MS. MS is still going. So
people will still have relapses. People will still be going through the diagnosis process. People will still be have concerns about their symptoms and their symptom management. And yet we are still here. MS doesn't stop, so we're not stopping either.
Here's a question about going into hospitals or to clinics. And I suppose this could be a routine check, but it could also be specific check for if you're on a treatment. So the person says, I was supposed to have a routine blood test next week. Should I go ahead with it?
Well, that's really tricky, isn't it? Now, a lot of the disease-modifying drugs that people with MS are on come with a monitoring schedule. So maybe every 3 months or 6 months you have a blood test or you have a urine test, and these sort of things are followed to check how you're responding to the drug and to check that there aren't any underlying side effects that could be causing you more problems. Now, the schedule that goes on under normal circumstances is really careful, possibly more careful and cautious than is strictly necessary in some cases. And so the Association of British Neurologists has put out some guidance about how you can keep people with MS really safe, but also reduce the number of times they need to come into a clinic to have a blood test and maybe put themselves at risk that way, and also reduce the impact on the NHS staff. So they might be stretching out the time between these appointments so that if you've got a routine blood test that's in the calendar for next week, I think it's quite likely that you'll find it's cancelled anyway, but you should check that. If you've not heard, then you should attend. You might find that it has been moved, so that maybe instead of going into a hospital, it might be a different clinic where they think they can keep you safer. So the location might change. If it does get cancelled, not to worry. All the most important monitoring for the people that are most at risk will still go ahead. But it's things like those regular reviews, your annual chat or your 6-monthly chat with the nurse. Right here and now, probably the NHS can't cope with that, and they will be focusing on the people with the greatest need. So if you still have relapse symptoms, if something changes with your MS, if you get a new symptom or something worsens considerably, then do still get in touch with your MS team. There will still be somebody there in the neurology department that can pick up your call and can give you information, and we are here as well if you need anything else in the meantime. So in terms of the routines, I think expect things to change. Go along, of course, if you've still got an appointment, but don't go if you are poorly with COVID-19, or if somebody in your household is poorly. And obviously you should let them know if you're not going to attend for that reason, so they can make plans and get you in again as soon as you're well.
Yeah. And I guess it's just about being a bit more flexible, but definitely from my own experience, appointments have still sort of happened, but like say it's on telephone or you have it via emails and things, and yeah, it hasn't stopped.
No, exactly. The services will still be doing their very best to look after everybody in their caseload, but there might be some slightly different ways of working. That's right. So face-to-face meetings might become phone calls or video calls. There might be bigger gaps between monitoring, and they might put some things off for the time being until, or move them to different locations. So be ready for change. But yeah, they're doing their best.
So the last question that we have, and this is something that we've seen sort of, it comes and goes. They speak about it on the news, and now it's popped up again. Should I be wearing a mask?
Oh, yeah, that is quite topical, isn't it, this morning? So right now, the World Health Organization is just going over its guidance again, just to be sure. Up until now, the World Health Organization guidance is that you do not generally need to wear a mask. It's not going to do any more to protect you than the social distancing measures and washing your hands is doing. We know that there are cultural differences around the world. In some places, it's considered, in the Far East, it's considered really polite to wear a mask if you've got any kind of sniffle or cold. And frankly, I wish people would do that in Britain sometimes. I hate being in a bus or a crowded tube carriage with people that are coughing and snuffling all over the place. You think, So if you're caring for somebody who has got COVID-19 symptoms, then you should be wearing a mask. And so that is largely medical and care staff, so nurses and care workers should be wearing. But if you have symptoms yourself, then wearing a mask, it helps to protect the people around you. But if you're generally healthy, you're at home with people who are generally healthy, and you're not seeing anybody else, you don't need to wear one at home. You don't particularly need to wear one when you're out and about either, if you're doing your essential shopping, so long as you're keeping that 2-meter distance and washing your hands as well. Now, that's the advice right now. As I say, it could all change by the time this goes out. Obviously, check the most recent guidelines with the World Health Organization and with the NHS, because that'll go up, and we will put it up on our website as soon as we hear anything different as well. What's it say?
But if people want to wear a mask, then they can.
Okay, here's my prediction. I think they will become a fashion accessory.
I've read that some people like having them because it makes them stop touching their mouth. So if they go into the shop, they might feel a bit anxious about things. So if they wear it, they feel people might stay away from them, but also it may stop them touching their mouth or their face if they are a bit worried, because a lot of that kind of touching of the face happens without you really knowing it.
Yeah, I think if you're the proper medical grade face mask, though, you have to put them on and take them off in a certain way. You need a certain amount of training to be sure that you're not cross-contaminating yourself or other people by using it wrong. So people that are just putting one on and then kind of lifting it up to sip their coffee or whatever, You know, if they're doing it for their own, you know, personal feelings, that's fine, but please don't expect it to be actually doing anything in terms of risk. And if you don't feel that you want to do that, then at the moment the guidance is that you don't need to. You only need to wear a mask if you are a health or care professional caring for people who are sick with COVID-19, in which case you would have had proper training in how to use it, or you have the symptoms and you are protecting those people around you, in which case, again, just look for information on how to use them properly.
Yeah, excellent. Thank you so much for chatting to us.
Pleasure. Pleasure.
And if there's any questions that wasn't covered in here, I mean, there's so many questions, you know, drop us an email, get in touch on social media, and we'll try our best to respond to them.
Absolutely. We're here. Bye-bye.
Thank you so much. Bye.
Bye.